You know what? I'm really tired of you guys arguing over every little detail. Just stick with my diagnosis already.
You haven't even said anything about a diagnosis yet?
Shit, I must be ahead of myself again. Sorry. Leslie, go ahead.
The symptoms are blepharitis, cold compression therapy, and inflammaging. We shouldn't ignore them because they could be pointing to a completely different disorder than imunoglycinuria.
Yeah, Leslie's right, Hawks. Let's really consider all possibilities before deciding on one diagnosis.
What about considering if it might actually be the other three symptoms causing another condition entirely?
For crying out loud, you guys just can't leave things alone, can ya? The patient has imunoglycinuria, and that's that. Now let's move on to the treatment.
That procedure is risky, sir.
And not guaranteed to be successful.
Look, I know it sounds harsh, but there's no other choice here. Just trust my judgment and get on with the surgery.
But why this treatment if you're so sure of the diagnosis, sir?
Because as their doctor, sometimes tough choices have to be made for the greater good. Now stop arguing and do your job. Look, I understand your concerns, but I'm confident in my diagnosis. This patient has imunoglycinuria, and a segmental resection is necessary.
I appreciate your experience, Hawks, but this track record of being wrong isn't exactly comforting for me or the team.
What are you talking about? I've been right all these years. You're just stuck in the past, Tracy. Let's focus on moving forward, not dwelling on old mistakes.
I'm not questioning your expertise, Hawks, but we need to base our decision on facts and current information, not past experiences. We should consider other options too.
There is no other way. I've studied the case meticulously. Every sign points to segmental resection being necessary. You can't just dismiss my professional judgment like that.
I'm sorry, Hawks, but I'm afraid I have to take this up with senior management. We'll get back to you after discussing this further.
Okay, that's fine. Have a good talk with senior management. Their opinions on whether or not we should do segmental resection are highly valued.
I will. Stay right here.
Oh, piss on that. Just use a phone for Christ's sake. It's not like senior management is one person who has an office on the top floor.
I'm afraid the patient is not recovering well from this segmental resection.
Indeed, Randall. And Hawks' insistence on this procedure just proves his ignorance.
The fact that he didn't consider the impact of imunoglycinuria makes me wonder if we should reconsider our approach to treatment.
Reconsider? Why don't we just abandon all rules and do something reckless?
What makes you think your reckless ideas would help this patient, Frank?
Well, since everything else failed, maybe a little recklessness could do the trick. Who knows?
That's not how we work, Frank. Let's focus on finding the right treatment for our patient.
I'm just trying to help, Randall. Sometimes, out-of-the-box thinking can lead to breakthroughs.
After yesterday, I never want to hear the goddamn word box ever again.
Here's an idea, though. We could resect the segment that was resected so it's reset in the right position.
That's a breakthrough.
Breakthroughs or disasters. We're doctors, Frank. Our priority should be the patient's well-being and safety, not a grandstanding attempt at novelty.
All right, you fools. You nearly killed that patient. Imunoglycinuria was just a misdiagnosis and segmental resection is the wrong treatment.
What the shit are we doing here?
But Hawks, what do you think the diagnosis actually is?
Yeah, Frank, what do you guys think it could be?
I don't know, maybe.
Imunoglycinuria again.
Ladies and gentlemen, we've achieved peak comedy. The secret is repetition. Why not re-diagnose the patient with the same thing we said this morning?
I think it's a great idea.
Of course you do. Tell that to the patient. I'm glad to hear you've been making some headway with your patients in oncology, Johnson.
Oh, it's nothing too out of the ordinary, just trying my best for them. It's a tough job, but someone has to do it, right?
Indeed, it is a hard calling indeed. I have been thinking about that perplexing case we've got on our hands.
Oh, what about him? Has he shown any improvements or something?
No, not exactly. But I just figured out what's wrong with him.
You did. That's fantastic news. I'm sure the patient will be happy to hear that.
Yes, I'm sure too. Well, it's been a pleasure talking with you, Johnson, but I have some things to attend to now. Nice lunch, though.
Wait, Hawks. What about our conversation? We haven't even finished discussing this.
I'm sorry, Johnson, but there are no more words in me for today. Have a good day.
Okay. Take care of yourself. We'll catch up later, I guess.
You've got to be kidding me, aminoglycinuria. That's absurd. We were all wrong.
It was wrong a second time.
Please shut up, Frank.
What do you mean? We were wrong.
We've been researching and testing for days. You can't just dismiss our findings.
I agree with Randall Hawks. There are protocols to follow before declaring a new diagnosis.
Well, I had lunch with Dr. Johnson and he helped me realize my mistake. We're talking about leontiasis osseosa now.
Leontiasis osseosa. What's the prognosis for that?
What does that even mean?
I think we need more information before we accept this new diagnosis.
It means a disease in which there is abnormal bone growth, Leslie. The prognosis isn't good, but it's not as bad as aminoglycinuria.
Okay, that helps us understand the situation better, Hawks. But we still need to validate this new diagnosis and discuss its implications on our patient's care plan.
All right. Well, I still believe that my team could have been more helpful with the diagnostics.
Helpful? You mean they should have done your job for you?
Well, not exactly. More like they could have actually acted like qualified doctors for once.
You were the one who made the diagnosis, Hawks. Not them.
And I'd make it again if they had given me better damn information.
That's exactly my problem. What if your doctors actually told the patient they had the same diagnosis a second time? How is that possible?
Tracy, through God, all things are possible. At least that's what that chaplain who works here said.
Here's a suggestion. Maybe figure out what consists of your team. Is it a mixed bag of miracles and curses?
As far as I'm concerned, it's all curses from here on out. Fuck you, I'm getting the holy goddamn fuck out of this shithole. Kiss.